My name is Jen McGee, and I am the Orientation Program Assistant for Family Programs at UMass Boston. We are so glad that we were able to move our Family and Friends program to a virtual setting, and thank you all for taking the time to join us tonight. So tonight we are going to hear from our Office of the Dean of Students, our Office of Public Safety, and then our Office of University Health Services, and they will be here to answer any questions as well. And then we have some OLs joining us to help answer any Q&A questions you may have, and then a student panel at the end. So I'm going to pass it off to the OLs to introduce themselves real quick. So Phaedra, go ahead.
Greetings and salutations, everybody. My name is Phaedra Farini. I am from Littleton, Massachusetts, and I use she, her pronouns. I'm a rising junior at UMass Boston. I'm majoring in psychology with a minor in theater arts, and I actually work at University Health Services as a peer health educator.
Hello, everybody. Sorry, I'm going home. My name's Ayana Williams. You can call me Yaya. My pronouns are she, her, hers. I'm a social psych human services double major and Africana studies minor. I am a department assistant in the Dean of Students office, and I'm from Brockton, Massachusetts.
What's poppin', everyone? My name is Navid Tabrizi. I use he, him, his pronouns. I'm a rising sophomore majoring in computer science, and I'm involved in campus as a badminton player in I'm League.
Hi everyone, my name is Liz Renner. I am a rising junior nursing major from Auburn, Mass. I use she, her pronouns, and on campus, I am a Beacon Ambassador for the Office of Undergrad Admissions.
Hello everyone. My name is Star Chanchantana and I use she, her, hers pronouns. I am a sophomore nursing major from Worcester, Mass. And outside of classes, I am a youth group leader for my church.
Hola, ¿qué tal a todos? I'm Nicolán Villalobos. I'm a rising sophomore majoring in biology. I use he, his pronouns from Braintree, Mass. And I'm involved in the Office of Student Leadership and Community Engagement at UMass Boston.
Hi friends, my name is Melissa Cepeda. I use she, her, hers pronouns. I'm a rising sophomore theater arts and psychology double major from Haverhill, Mass. And I am involved with the Performing Arts Department on campus.
Hello, Beacons. My name is Sarah Owens. I'm from Burlington, Mass. I'm a sophomore nursing major. My pronouns are she, her, hers. And off campus, I'm a volunteer runner with Back on My Feet Boston chapter.
Thank you, orientation leaders. So now, since you have all gotten a nice welcome from our orientation leaders, I'm going to pass this Zoom call off to our Dean of Students, John Silveria, to get us started for our evening.
Good evening, everyone. My name is John Silveria. I'm the Dean of Students at UMass Boston. I've been here for about 3 years. Welcome to our presentation tonight with family orientation. I'm joined tonight not only by our orientation team, but we also have 2 other presenters. One of them is trying to get on, and one of them is with us right now. So I'll ask Matt Coviello to introduce himself.
Good evening. My name is Officer Matt Coviello. I've been with UMass Boston PD for about 9 years, and my role here is a community resource officer.
All right, folks. So I guess we're going to get started. I am sure that there are a number of people who are on this call who are wondering about a few things. One of them that people are probably wondering about is whether or not housing is going to be open in the fall. And one of them is probably what our campus is going to look like in terms of course delivery. And neither of those things have been officially set yet. However, if I were a betting person, I would probably bet that the majority of the courses in the fall are probably going to be online. And I would also probably bet that if you were interested in housing and you'd already applied, that was a good thing because we will have housing available in the fall. And we are looking at having it set in a certain way so that individual students have their own room. So I can tell you that that's where we are at the moment. I expect that the university will have a full announcement later this week that'll make it easier to answer a whole host of those questions. But I thought I would answer those 2 immediately since I anticipate people have a whole set of questions around them. So tonight you're going to hear a little bit about the Dean of Students Office, from Public Safety, and from Health Services. We'll be joined by Rob Pomalis, who is the Director of Health Services, in a few minutes. So let's get started. If you guys can bring up the next slide. Okay, the Dean of Students Office. We are part of the Division of Student Affairs, and we're going to go right to the next slide. Our mission is listed here, and I think the biggest thing that I can answer for you is that at a large institution, our goal really is to be the place that people go when they're not sure how to solve a problem. We work oftentimes with students who aren't sure, how to manage a large problem around absences. They may be concerned about an issue around finances. We have students that come in who miss time away from school for sickness and need help and support with regards to their classes. And we also have students that have some complex, crises going on that work with us. We are also the office that's responsible for the Student Code of Conduct, and our office manages the student end of Title IX as well. So we will go on to the next slide. How we can help. Again, the majority of what what I talked about on that first slide, issues that you don't know how to resolve. If you're having difficulty navigating campus organizations or connecting with a department, oftentimes one of the biggest things that we see is peer referrals. Peers are, one of the biggest sources of referrals to our office. We find that students oftentimes are looking for some guidance, and it is friends that are bringing them to us to get some of the support that they need. We can go to the next slide. The Student Code of Conduct. Something to know about our Student Code of Conduct is that no matter where or when the conduct may take place, we do hold our students accountable for it. We have a whole set of community standards around respect for persons, property, and the university community. And you can see in the bottom of the slide, this is the short link to our Student Code of Conduct if you're interested in taking a look at it. Students do often ask us this, if they live off campus and something occurs in their apartment. Let's say that they have a noise complaint. Let's say that they're responsible for a party or a large gathering. If we're made aware of it, we do hold students accountable for that. So that is something that may be different than what they've either experienced on other campuses or what maybe you've had some of your own students at home experience on other campuses. We can go to the next slide. Top 5 policy violations. We can go right to the next slide and we'll talk about those for a minute. The biggest ones that we really run into, issues around our residence hall agreement, alcohol, drugs, disruptive behavior, and academic dishonesty. And I have to say, for those of you who might be sending your first student off to school, or who may be sending your first student off to school and having them in housing, the majority of these things in the first 4 are usually things that happen as a result of living in residence. And that may sound a little strange, but the reality is that when you have 300 to 1,000 people living in residence, sometimes you have situations that occur that need to be adjudicated. The other one that comes up, and it comes up primarily with first-year students and I would say seniors, is around the area of academic dishonesty. And the reality is that about 90% of this is preventable. What we find is that students are still learning how to write effectively. They're still learning how to research and cite properly. So that that is one of the biggest challenges that we see. And usually with juniors and seniors, what we find is that people are in a little bit of a rush, and those that's the reality. So these are things that the institution takes seriously, and I wanted to share what we consider to be our top 5. We can go to the next slide. Some of the common sanctions: loss of privileges such as guests, alcohol and marijuana sanctions. We will send a note home to families if a student is found responsible for alcohol sanctions and they're under the age of 21. The same for marijuana sanctions. And then from there, it's progressive. So a number of things may happen if they happen to be in housing. They could be put on housing probation. They could be removed. There are also, sometimes we have students that are put on university probation. And then with regards to academic dishonesty, the common sanctions are Failing an assignment, getting a 0 for an assignment, or failing a course. We can go on to the next slide. Again, some of the highlights of the student code of conduct and some of the things that we typically see in the areas of alcohol and other drugs, safety, care of property, and academic integrity. Next slide. FERPA. This is one thing that I think families need to make sure that they understand. When a student reaches the age of 18, with the exception of a crisis situation, we do not share information about student concerns, and we only do so on a need-to-know basis. There is a way for families to actually better understand what's going on with their individual student, but we often hear from people that they're concerned that they might be paying the bill, but they're not even seeing the bill, or they don't know their students' grades like they did when they were in high school. It is a change, it is a shift, but there is a way for a student to fill out a waiver to give families access to this information. I believe that comes up on the very next slide. And it's right here. So granting access to Wiser. This is something that allows you to better see what's going on with your students' grades and allows you access to see how they're doing in and out of the classroom. Next slide. Title IX. Title IX is also, and our non-discrimination and harassment policies are managed out of the Dean of Students Office. This covers everything from sexual violence and harassment, gender-based harassment, dating violence, domestic violence, stalking, and retaliation. So we coordinate that for students along with the Office of Civil Rights and Title IX. And if you'll notice, there is a phone number here and also an information page, www.umb.edu/Title IX, that will provide more info. And for anyone that's concerned, this entire presentation will be shared and will allow you to actually have access to these. Next slide. And something to have for all: critical phone numbers and email addresses. So Dean of Students Office, this has our office hours right now, our phone number, the UMass Boston Police Department cell phone emergency number and non-emergency number, and University Health Services for medical appointments, counseling center appointments, health education, outreach services. One thing that I will mention is that we have been working, obviously, since the campus shut down in mid-March on a virtual basis. And so even if you call the phone number to the office right now, we receive an email almost simultaneously with any voice message that came through. We then send it out to one of our staff people who's waiting to answer questions. And then we follow up immediately with people. But I do find that the easiest thing to do, if you don't need to talk to somebody immediately, is to email us. And that email address is checked 24/7. And now I'll turn things over to Matt Coviello and the UMass Boston Police Department.
Okay. Like I said earlier, my name is Matt Coviello. I've been here 9 years, and my main function is the community resource officer. I've been doing this for about 3 years, and my whole role is essentially to be the liaison between the students and the police department. So we actually did a orientation video that features our chief, our training lieutenant, as well as 2 of our cadets that pretty much explain everything we have to offer here and how we keep your students safe.
My name is Chief Donald Baynard of the University of Massachusetts Boston Police Department. And on behalf of the men and women of the UMass Boston Police Department, it brings me great pleasure to welcome all of you to the home of the Beacons. The members of the UMass Boston Police Department serve the university community with great pride and professionalism. We are committed to our community's safety by providing round-the-clock service to maintain a safe educational environment so that our students can pursue their dreams, flourish, and excel academically. We strive to foster partnerships with our students, faculty, and staff to address quality of life concerns and to reduce crime through education, prevention, and awareness. We achieve these goals by being transparent with our community and maintaining the community's trust. So again, welcome to our beautiful campus, and please remember, anytime that you need us, we are here for you. Please let me introduce our Community Resource Officer, Officer Matt Coviello.
Hi, my name is Officer Matt Coviello, and I would like to formally welcome you to UMass Boston. I'm here today to tell you what the UMass Boston Police Department has to offer you, and explain who we are and what we do. We have 27 sworn police officers, from patrolman all the way up to chief. We have 3 institutional security officers that they're our eyes and ears for the police department. They do key calls as well as foot patrol throughout campus. If you need to get into a lab late at night and you're on an access list, the ISOs are the ones who do the key call and get you to where you need to be. We also have 8 dispatchers. They are here 24/7, 365 as well. Once you call our emergency number, they're the ones who are answering. We also have the same authority as any full-time local or state agency. And we get our powers through Mass General Law, Chapter 75, Section 32A. Next, I'm going to tell you about our roles and how we keep you safe. First, we investigate any incident that has happened on campus, as well as any emergency. We have a Bureau of Investigative Services that will do the investigation after the initial report by a patrolman is taken. We also provide safety escorts. What a safety escort entails is if you are studying and you don't feel safe getting to the location where you need to be, you would call our dispatcher. They would send an officer to your location, and we would escort you to your final destination within reason. The JFK stop, Bayside, Harbor Point, Peninsula, or any parking lot on campus for that fact. We also maintain blue light phones. There are 25 blue light phones all around campus. Once that blue light phone emergency button is hit, dispatch is notified the location of it, and they're able to hear anything that is happening in that location. Once that button is hit, officers will be responding within seconds. So please remember that's for emergencies only. Those officers that were responding are on foot, bicycle, and motor vehicle patrol. We also manage the security camera system throughout campus. Our newer buildings have an amazing HD camera system, and it's very impressive. It helps us solve a lot of crimes on campus. We also manage the Rave Alert system. What the Rave Alert system is a program that if you sign up, you'll be notified of any threat or emergency on campus, or even just as simple as a snow day. You can sign up by email, text, or telephone notification. Also, parents and family members, I would suggest that your student puts your information in there as well, just to stay in the loop. We also produce the Clear Report. The Clear Report is a database of any crime that has happened on campus or adjacent to campus for the past 3 years. And that's available right on our website or in a pamphlet at our police department in hard copy. We also produce the Daily Crime Log. The Daily Crime Log is made up of any incident that is called into dispatch, and the mass media and as well as administration often will have access to that. Due to our high volume of pedestrians, we do have speed enforcement on campus. Officers will be in their vehicle or on foot doing LiDAR. The reason behind that is because we want to keep you safe, and that is our #1 priority. Next, I want to talk about our RAD Women's Self-Defense Program. I have a video you might like to see of me in the suit and one of our past students doing a very good job in what we taught her. The class is made up of 4 different sessions over 12 hours and is totally free. It's free. Take it. It's open to the community as well, so if you have friends or family that are interested, please let me know. I've been teaching for 6 years and I really do enjoy it. Check out the video. I would like to introduce you to Lieutenant Camborian, who is in charge of all of our training.
Hi, my name is Lieutenant Christopher Camborian, with the UMass Boston Police Department. I currently serve as the Training Division Commander for the department, and I'm also a certified police instructor. The UMass Boston Police Department offers various trainings to our university community, one of which being the most prevalent in our day, active threat and preparedness training. Through that interactive training, we'll focus on the concepts of run, hide, fight, and we'll teach you tactics and safety measures to keep you safe in an active threat situation. One of the other things that our university also has that we're very happy to have in University Hall is what we call our lockdown systems and our lockdown buttons. These buttons can be activated by any community member who feels they're in an unsafe situation or they're posed with an active threat situation. What happens with these buttons is once they're activated, they will lock down that area that individuals are in so that they do not allow any other individuals into that room and to keep safe during this threat, during this time. One of the things that we can do from a police side is we can access those rooms with our emergency card to get in when we have to go through and check the safety of all occupants inside. However, this is a unique feature that UMass Boston has that many other universities do not have the access to have. And to give you an example of what our lockdown button looks like, as you can see behind me, this is how easy it is to stay safe in an active threat situation by activating one of these buttons.
What is the most common crime on campus, you might ask? It's larcenies. Last year we had 44 larcenies. Of those 44, approximately 70% were from property left unattended. We've had people call the dispatcher after leaving a laptop in the common area of the campus center, go to lunch, come back, and it's missing. I give you this statistic not to victim blame, because in that case we especially got it back due to the camera system we have. But please, we even started a promotion called Like It, Lock It, Keep It, to remind you, if it's expensive, if it's worthwhile for you, lock it down or just bring it with you. Another program that I'm very proud to be a part of is the cadet program. I've been the director for the past 3 years and really enjoy seeing the growth in every student that applies. You can do it as a work study, resume builder, or even as an internship and get credit through the university. What it entails is that you would help with parking enforcement, ride-alongs, learn how to take police reports, as well as come to the gun range and court. If you have a future or desire to do something in law enforcement, please reach out to me or check on our website, cadet program application.
Hi, I'm Desmond Cameron.
And I'm Mariah Log.
And we're cadets here with the UMass Boston Police Department. The Student Cadet Program is an amazing opportunity for students to learn about what police do on a day-to-day basis and to figure out if they want to pursue a career in law enforcement.
Some of the roles as cadets that we have are parking enforcement, which involves patrolling the parking lots and giving parking tickets, and doing building checks to make sure the buildings are secure.
Additional roles that we have are assisting with key calls, so if faculty get locked out of their offices, we can go let them back into the building. And also tobacco ban enforcement, because on campus you're not allowed to smoke tobacco or use tobacco, so we want to make sure that we're following all the rules on campus.
An opportunity that we're lucky to have as cadets here on campus is we can assist with emergency calls on campus, so we get to see how law enforcement deals with emergency calls.
Another opportunity that we have on campus is getting to attend ride-alongs. So we get to sit in a police car with officers, and we get to see what goes through their minds when they're stopping civilians and when they're running plates to see exactly if they have any warrants or anything wrong with the vehicle.
We also get the opportunity to leave campus with some of the officers. I've been to court with the officers to see how a ticket appeal works.
On the topic of leaving campus, we also can go on to the gun range with officers when they go to qualify, and other opportunities such as model training, which isn't available to regular civilians.
As a cadet, you get to meet a lot of people around campus. You get to meet the law enforcement officers, and you get to meet members of the community, and you get to learn a lot from them and assist them.
And you never know what kind of resources are available to you here at the UMass Boston Police Department. It could be as simple as just meeting an officer who can write you a letter of recommendation, or getting a job here at UMass Boston after we graduate.
The UMass Boston Police Scholarship is something I'm very proud of, and another avenue to connect with the community. Last year, we donated $42,500 to students who had a public service major. When you apply, In your essay, explain how your major can help the public in the future, and that's all you need to do. Our funding is entirely made up of parking tickets. So if you get a parking ticket, you're helping that fund, so you should apply. Our parking tickets are disseminated by officers and cadets. Our police department is located in the Quinn building on the plaza level. And I urge you to please store our telephone number, 617-287-1212. That is our emergency line. If you dial 911 from your cell phone, it'll go to the state police barracks. By the time you explain your emergency and they transfer over to our dispatcher, that could be valuable seconds lost in an emergency. So please store that number. Also, if you pick up a telephone in any building and dial 911, it will also connect you to our dispatch. I really appreciate your time and attention, and I truly do believe this is one of the safest campuses in Massachusetts. I take my role as community resource officer seriously, and I genuinely do love meeting new people. If you see me around campus, please say hello, get to know me, and also help me take a bite out of crime.
Pretty much the meat and potatoes of it.
Well, let's turn things over now to Rob Pomalis from University Health Services.
Good evening. I am very pleased to be here to talk to you a little bit about University Health Services, why we exist, and what we do. Our main goal is to be a support to your student so that they can be as successful as possible. We have three departments within University Health Services. First, you see on the slide here, we have our general medicine clinic. Now, the general medicine clinic is a full-service primary care provider. We have physicians, nurse practitioners, nurses, radiation technologists, lab personnel. So we're able to offer the full range of healthcare services that emerging adults need. It's actually a very good transition from pediatric care to adult care. Not only are our providers specializing in the care of late adolescence, early adulthood, we also work to help them understand how to make their own healthcare decisions, manage their own healthcare, understand the concept of insurance, how to use it, and how to be good advocates for themselves with healthcare providers in the future. Our clinic, our general medicine clinic, which is located on campus, we accept all insurance. So it really doesn't matter what medical insurance you happen to have. You do not have to purchase the school insurance. We will accept Mass Health and all other commercial products. It also includes a dental clinic. Twice a week, we have a dentist on site who's able to provide general dentistry services at a very low cost to our students. Most students don't have dental insurance, so we know that that can be a barrier many times to getting proper dental care. So not only do we encourage students to do it, we help them make sure that they can afford it. We have payment plans if necessary, but it is something that they can do, they can access on campus. One thing I do want to make sure you understand is that it is never our intention to be a barrier or an obstacle to getting the medical care that our students need. So oftentimes, you know, students will delay seeking care, be concerned about the idea of having to come up with a copay, or will have some other financial barrier. And we make sure that all students understand that our priority is that they get their care, and we will work with them on the finances. If they don't have insurance, if insurance doesn't cover it, if they need their co-payment, we have payment plans. I have hundreds of students who are paying as little as $5 a month for outstanding balances, and we will offer payment plans and flexibility always to ensure that our students are getting the health care they need. The other department that we have within University Health Centers is our counseling center. Now, just like our medical care, it is a fully staffed, comprehensive clinic staffed with psychiatrists, psychologists, social workers, who offer the full range of mental health services and counseling to our students. Medication evaluation, prescriptions, ongoing counseling, emergency intervention, group therapy, support groups. All of those services are available to all of our students. Now, unlike the general medicine clinic, we do not bill insurance for counseling services. They're at no additional cost to students, and they're accessible to all students. Both the general medicine and counseling have 24-hour crisis lines, emergency lines. So whenever we're not open, our on-call service will answer all calls 24/7, 365, no matter where the student may happen to be. They don't have to be on campus or in Boston. And they can talk to a psychologist or a nurse, depending on what the issue of concern might be. And those professionals can direct them to what is the best course of action. They can call an ambulance for them. They can instruct them where to go, an emergency room, tell them where the most convenient urgent care center might be, or urge them to call in the morning and make an appointment with our clinicians. Our offices are open from Monday through Friday from 8:30 to 7. Now, obviously, this part is not in the slide because we are currently in remote operations. All of our services are still available. We are offering telemedicine appointments. We are doing telecounseling, both for prescriptions, for ongoing therapy. We're doing telecounseling group therapy. We're doing telecounseling support groups. Our physicians and nurse practitioners are doing appointments via telemedicine when it's necessary to have a lab done, or if there needs to be a physical examination component to the visit, then we have a couple of different options. We can send an RN to do it, or we can have them come in by appointment to have the physical exam portion of the visit. So all of the services will be available to students indefinitely until we end this process of being remote. If you have any specific questions about our telemedicine services, you can either go to our website or you can reach out to us directly, and we'd be happy to show you how that works. We're really pleased with the way that we've been able to roll this out, and the utilization has been great. We just completed our 2000th telemedicine appointment. I believe yesterday, yes, yesterday afternoon was our 2000th, combined with counseling and medical services. So we feel like we've got this down, and we can really offer good services for our students, whether it be in person or remotely. The other thing we do is we have a program that is education, wellness, and that's where we try to educate all of our students about how to stay safe, how to stay healthy, how to have healthy relationships, where to seek care, when to know, when to seek care. And we offer many other support services along with that for students who might be in recovery, for students who have some particular special affinity group or interest that we can be of support to them. So all of these services will continue, whether in person or on a remote basis. Our simple goal is to simply help students be as successful as possible. And I think that pretty much covers what I was wanting to say. One last note. We will have a COVID-19 clinic on campus beginning in late August. At this satellite clinic, we will be able to offer all treatment, evaluation, and testing services related to COVID-19. So if any of our students are experiencing symptoms or are concerned and want an evaluation, want a test, we will be able to provide that for them on site. Indeed, thank you. Yes.
Thank you all for sharing some information about your offices. If you all wouldn't mind staying on for a few more minutes, we are going to open it up to some questions. There is a button under, I believe you have to hit participants, and then you all should be able to use the raise hand function if you would like to ask a question out loud. Otherwise, you can ask it in the Q&A, and we would be happy to relay it to our presenters. So we do have a few questions. So Rob, we had a few questions about if you could discuss how the health clinic handles possible COVID-19 cases. That would be great.
Sure. So you might know that we, in fact, our clinic was the first to diagnose a COVID-19 case in the eastern United States. So we are quite well prepared and personally aware of all of the challenges related to providing adequate care for COVID-19. Like I said, we are in the process of creating a satellite clinic specifically for the evaluation, diagnosis, and care of students with upper respiratory illness that we need to rule out as being COVID-19. We will have on-site rapid testing, so we will be able to test our students and have results within 15 to 45 minutes. In the case that someone were to test positive, we would arrange for isolation. So we would work with the student and the family to identify the best place for them to complete their isolation period. And following that diagnosis, we're also fully equipped and ready to do all of the contact tracing investigations that would need to be done for any contacts that the student had while they were presumed to be infectious. So we have spent a great deal of time planning, thinking this through, researching the best practices, and we are confident that we can implement those with our staff in the very near future.
Thank you. And then Dean Silveira, would you be able to address how housing would house a student if there was a possible COVID-19 case, if they were in the residence halls?
Sure. So we are currently looking at a strategy that would assign one student per bedroom and per bathroom. So the majority of our rooms in the residence hall have a bathroom within them. We also have a number of rooms that we're going to be making available with an individual bathroom and shower stall assigned to a student. And so we'll be doing it that way to minimize their contact while they're in the residence hall. And we will also have 4 additional rooms that we will be setting aside as quarantine rooms should a student who lives in the residence hall contract COVID-19 and need to be isolated.
Thank you. And we see that David actually has their hand raised to ask a question, so I'm just going to allow you to talk, and David, you will be free to answer your question.
Yes, students can have cars, David. If they're living in the residence hall, we make it available that students can purchase a parking pass that allows them to keep their car on campus. It's available through our parking website. So you can find that on the UMass Boston website at Parking Services. And if they don't happen to live on campus, students can certainly bring their cars to campus. There are no shuttles to the seaport. The shuttle that we have actually runs from campus to the UMass Boston stop on the Red Line.
So we did receive a question in the Q&A about if you could possibly discuss the fall virtual courses and plans going forward to return to physical classes.
I don't know if we have all the information yet, Jen. I do anticipate that by the end of the week that we will have something out to the community in general that should list out what is going to be available and how courses are going to work. So it would be a little presumptive to do it now, but I do anticipate that the majority of the courses that we will be offering in the fall will either be in online format.
Thank you. And then we have a question in the chat for Rob. Rob, how would a parent or student find out if the UMB Health Center is in their insurance network?
So we will accept any insurance. Some insurers will require that we have a referral in order for us to bill for services. We will work with your student to make sure that they know how to do that and help them get that done. But generally speaking, if an insurance chooses not to cover something because we're out of network, we will either write that off or find some way of ensuring that your student receives the care they require. But generally speaking, we're able to work with all insurances, including out-of-state insurances, and it has not generally presented a problem. As you can imagine, it's not unusual to have a student with an insurance that's out of network. So it is something that we can do, and I guarantee you would not be a barrier to seeking care.
Thank you. And then for the orientation leaders, this question is for you. So for those of you who have lived on campus, what are the advantages to living on campus? And then, so after Melissa and Liz talk about their experience on campus, would Naveed and Nico, would you mind talking about your experience commuting?
So what are the benefits of living on campus? Was that the question? I can't say it.
Yes, the advantages to living on campus.
I'd say one of the biggest advantages that I personally had living on campus, everyone's experience is different, but I personally really liked making connections with the people, just passing in the hallway and just being like, oh, hey, or in the dining hall sometimes when you just sit with people and eat, you just start conversation that way. And then the common rooms, doing homework and stuff, that's kind of that was kind of the biggest, most plus side of living on campus. Also, it's a lot easier if you have rehearsals or practices and stuff like that to just be able to walk home and it's 5 minutes away from where you are.
Yeah, my experience was kind of the same. I think one of the biggest things for me was convenience. If I commuted, I would be coming from about an hour away, and I think just being on campus and being so close to all of my classes was a really big thing for me. And all the resources on campus also was very helpful. And then in the same kind of way, building those relationships with other people that lived in the dorms and the staff in the dorms and those kinds of things as well were really beneficial for me.
Thank you. Nico, would you mind starting us off with the commuter experience?
Yeah, of course. I would say for me being a commuter, I was I had to have like a really more tight schedule because I was taking some classes in the morning and I would have to wake up earlier, and that was not really convenient for me. I would say that's one of the things that I didn't really enjoy that much about being a commuter, and I hoped I had lived on campus. But also, I would say that at the end of the day, you just kind of want to disconnect. And I had the relief of being able to get home and just be on the comfort with my parents and everything. So I would say that was like the good thing about being a commuter. But it was also kind of hard to make connections since I was not living on on the rest halls. It really depends on what you're looking for coming into your first year in college. So I would say it was a good experience, but I would definitely be wanting to live in the results if I had been a freshman again.
In my experience, my experience was kind of different than Nico. I kind of live further than Nico lives in from campus. So the only kind of hard thing that I really had to manage was I had to take all my classes in order back to back. And also I had to kind of take my classes actually after 9 a.m. so I would be able to actually get to campus and not take any classes after 7, because then I would have a hard time to get back home. Because in Boston, we live in Boston, kind of winter, it's kind of going to be harder for people that commuting. You have to make sure you give yourself more time, because of the red line, I mean, T buses, it might going to be a little bit late for your classes, so you have to give yourself more time, and kind of be really on time. Try to wake up much more earlier than other students, because you will actually spend for me, I spend 1 hour to get to campus and 1 hour from campus to get home. So it's kind of you losing 2 hours of your day. So you kind of have to be really manage your time so you would be able to get to the homeworks assignments that you have. So that's really one thing.
Jen, I actually want to piggyback off that a little bit because I'm a commuter student too. I think it very much also depends on the intensity of what you're doing at school because I have a lot of involvement because I was on the STEP team. I work in the dean's office. I'm on the student equity and access team. I'm also an orientation leader. But I live in the Seaport, so I'm like 15 minutes away from school. So it also is very similar to what Naveed and Nico were saying. It depends on where you're at commuting from versus Melissa and Liz who were staying on campus. It's very helpful when it's very close. And for some people, depending on what you're doing, it may be cool to just go right there. But if you have like a long day and it's not as far, it's really not as bad. I think if you're close enough and you can make the commute, because I'm 20 minutes out, it's worth it. And especially with the dorms, there's still a significant amount. There's only a selected number of dorms that there are because they're still new. So, and the apartments are close too, but depending on what you're looking for, also like what Nico was talking about, it's just what you personally want. I didn't necessarily want to move out to go because I'm an only child, so I like my space. I'm okay with having my own room, but some people want to go and break out, especially out of state students, and they may not want an apartment and they want to enjoy the dorms as well. So it just depends really what you individually want, but both really there's not as much of a disadvantage more than there's an advantage on either for me personally, if that helps.
So I know it has passed 8 p.m. So if anyone does have any further questions or if we weren't able to get to your question, I am sorry about that. But we do have the presenters' emails and the phone number for health services. That is their question and front desk line. So for the Dean of Students, that would be dean.students@umb.edu. To call and speak with a representative of health services, that would be 617-287-5680. Public safety is public.safety@umb.edu. And then, of course, you can always email our office at orientation@umb.edu, and we'd be happy to help in any way we can. Thank you all for coming and joining us for the virtual Friends and Family program. There is one on Money Matters next week if you would be interested in joining. We would love to see you all here again. And this will also be available on our YouTube channel. The link was sent in the chat along with the link for the public safety video. So please feel free to refer to this whenever you would like, and we thank you again for joining us.